Good afternoon, everyone. We are Group 5 composed of Aguilar, Tacones, De Los Santos, Gallardo, Irabon, Manuel, and Obias, and today we are going to present a case discussion on a hypothetical scenario related to the ethical, social, and organizational issues in oral health informatics. And first, let us give you a background on the case before answering the questions assigned to our group.
In 2025, the UP College of Dentistry is implementing an EHR system to digitally store patient information and facilitate referrals among different sections in the college. In consideration of both faculty and non-academic staff who lack technical skills for the new system, the college is urging them to first accomplish the old paper-based patient records before transferring it to a digital database. Concerns have arisen from the digital system's usability, which led to minor conflicts, but the administration assures that it will become easier to use with continuous usage and practice.
Ms. A, the patient, visited the UPCD clinics and was informed of the new system. She signed a consent form from a non-academic staff member, Mr. D, which contained a clause about the potential use of her information for research purposes. During the patient workup, Ms. A disclosed to Ms. C that she has HIV and eventually recorded it on paper. However, while transferring the data to the EHR system, Ms. C left the record facing up on his desk, allowing an acquaintance, Mr. B, to see it. Consequently, he was able to find a way to share it with his friends, albeit without malicious intent.
After some time, Ms. A discovered a social media post revealing her having HIV. She was devastated, prompting her to file a case against UPCD for breach of security and confidentiality, as it was the only place where she disclosed her status. Additionally, she denied consenting to digitize her personal information. Hence, when the consent forms with her signature were presented, she was claiming that it was not explained properly and was pressured at that time.
After learning about the case, let's now move on and answer the guide question: what social issues are identified in this scenario? First is the breach in security and access. This social issue was identified since no one was really supposed to have access to Ms. A's patient record except for Ms. C and the UPCD clinical department. Second is the legislation for the protection of confidentiality and security. This is committed when a person, or in this case Ms. C, provides access to personal information of the data subject, or in this case is Ms. A, due to his or her negligence. Such can be associated with the Data Privacy Act of 2012. Third is the failure on the identification of data. This refers to the failure of making the patient information unidentifiable and undetectable, which in this case was evidently done by Ms. C. Fourth is the social issues within the organization. Ms. C may have been encountering issues with the new system and is still adjusting with the entire organization. This may have shaken the organization's dynamic and teamwork, which then partly caused the negligence. Fifth is inequality. Ms. C struggled to adapt to the new system, perhaps due to insufficient digital literacy. This reflects the social issue of inequality of access to digital skills and resources.
For the follow-up question, is there something that could have been done to prevent these issues from arising in this particular case? To address breach in security and access, they may opt to improve the record-keeping system from paper-based to digital-based. As mentioned from the given scenario, Ms. C simply placed the paper record on the oral diagnosis desk to digitize it. It would have been more secure if there were a designated container for paper-based records so that other patients don't easily see them. As for legislation for the protection of confidentiality and security, it is essential to emphasize patient confidentiality through proper training and protocols in healthcare settings. Someone who has sensitive information must exhaust all means to protect the data. As for Ms. C, she was negligent on the part where she had to transfer the data on the EHR system, causing other patients to see what's written in her personal record. Hence, proper training and protocols shall be implemented to prevent individuals from accidentally accessing sensitive information. To address de-identification of data, they may opt to use codes to protect and de-identify the patient. Doing this will lessen the risk of spread of the sensitive information. Lastly, as for social issues and inequality within the organization, conducting test runs and orientations for the implementations of EHR might be an option. This involves a thorough explanation on the benefits and proper use of the system. Additionally, this may include simulations, training, and system trials, which would help the organization to appreciate the use of the system more.
And that is it for our presentation. Again, we are Group 5 and thank you all for listening.